And we're back on this Tuesday morning. What a cold Tuesday morning it is. 31 degrees out there this morning, and it feels every bit of it. Should be a little windy out there today, too. High temperatures around 55 with your low of 30. Tomorrow, 57 for that high, mixed with some clouds. 36 for the low, and the rest of the forecast, 30%, only a 10% chance of those showers today. Chances are you're not going to see any rain. Wednesday, that jumps up to 30%, but we may just see a pop-up shower, and that is about it. No rain to worry about, just cooler temperatures sticking with us. 230-4988 does get Frank this morning. I'm here with Dr. Jan White. As usual, I was going to say as usual on a Wednesday, but of course today is Tuesday, so not as usual. How are you?
Great, thank you.
Good, good. Now you're talking about obesity and heart disease.
Right,
today.
I'm talking about heart attacks, but I didn't start out talking about heart attacks. I started out looking at an article about looking old for your age and earlobe creases and balding. This is the article on the screen now that I found in the newspaper.
Okay.
And I thought, well, let's look into this. So where that led me, and you know, by the way, as a researcher, they call us investigators.
Well, you are a very good investigator.
So this is like a Sherlock Holmes exercise here. So where did this article take me? Well, I learned that these fatty bumps around the eyes and the earlobe creases.
We're talking about yellow, not white. The yellow fatty deposits around the eyes.
Right, and balding and hair loss. Well, all of those markers indicate to physicians that, you know, we need to look a little farther, that there could be a problem here with heart disease. But what bothered me about that is it suggests that maybe women are not at risk.
Can I show this picture?
Yeah, I found a couple of graphics that I found annoying, but we're going to show them to you anyway.
I'm going to show this. I know you didn't want to show this because it may scare some folks, but then also it has, of course, has a male on here who is, of course, balding.
Right.
But check out the earlobe down at the bottom of the crease.
That diagonal crease. Now that's old news. I found a research article from the 80s.
Everyone's been checking their ear. Tom, I'm sorry.
Right. But
Jamie, I'm sorry.
That's old. That's just maybe an indicator to a physician who might be looking at you and examining you. But if you would not mind holding that up again, this other graphic with the man on it.
Oh, okay.
That accompanied an online article related to this newspaper article. And what bothered me about it is they show a man. The man has the balding, and the man has the fatty deposits in their earlobe crease.
What about women?
But women, heart disease is the #1 killer of women.
Not breast cancer, not other cancer, but heart disease.
No, it's heart disease. So what I don't want is I don't want women looking at these graphics and saying, oh, well, I have nothing to worry about. This is like a guy thing because they're talking about balding.
Because immediately I've not seen any hair loss. I've no fatty deposits on my eyelids, no crease in my earlobe.
Right. So you know, the graphics are very powerful because they give you a subliminal message. So you think, well, you know, I'm not bald. I'm doing fine. So anyway, here's what I found out in my investigating. I found out that, again, you know, heart disease is the #1 killer of men and women, and it is the #1 killer of older adults. Older adults are usually non-compliant with their drug regimen after they've had a heart attack.
Now, what do you mean non-compliant?
That means that they're not taking their pills like they're supposed to take them. Exactly.
We dealt with this with Jamie's parents.
And see, that's preventable, you know.
Well, they think, well, okay, I'm supposed to take this one twice a day. I'm just going to take it once. That way it's taken care of, I've done it, and we're good to go. Well, they're time released, more than likely. Right,
or I'm feeling pretty good today, or I don't feel like my blood pressure's up. So I
don't need it.
Right, and so how would you know if your blood pressure's up or down? You know, take the drugs as prescribed and, you know, go from there. So I also found that most of heart attack risks are controllable. And remember last month we talked about obesity?
Okay.
There's a correlation between obesity and heart attack, but there's other controllable factors. There is smoking, high blood pressure, high cholesterol, diabetes, being overweight, obese, and excessive alcohol consumption. These are all risk factors that we can control.
Oh, definitely.
Okay? So it's not like it's hereditary. And I found the, if you wouldn't mind holding up the map, you know, last month I brought the map of the obesity, and Alabama is the fourth fattest state.
Oh, I thought we were too, so good. Okay, we're up at 4.
But look at the interesting, the heart disease map is on the right in the red, And the obesity rates are on the left. So look at those orange states with the high obesity, and then look at the red states with the high heart disease. There is a correlation between obesity and heart disease.
Well, obviously, if you're that much overweight, there's going to be health issues.
Oh, absolutely. Far beyond heart disease.
And now you have ages 35 plus. I mean, 35, that young, they're experiencing heart disease, and
children.
Obviously, oh, how sad.
The obesity problem with children, children are having heart disease.
Goodness.
And see, again, that's preventable. That's controllable.
Shouldn't that be child abuse?
Well, I personally think it's abuse, but you know.
I mean, you're supposed to be taking care of the child, not letting them do whatever they want and get so obese.
I know, and that has lifelong repercussions. So, of course, what we want to do is, older adults especially, stay on those meds.
Don't alter them.
Good nutrition, weight management, physical activity. So, you know, those couch potatoes, couch potatoes need to get up off the couch and start moving around.
Layla, get them off that couch.
And, you know, with the elections, all these health care costs, you know, that was a big discussion. Coronary heart disease cost Americans $108 billion. Each year, health care, medications, and lost productivity.
Just imagine what it's going to be in a couple of years.
That's right.
Astonishing.
So I also found out from the Journal of the American Geriatric Society that 50% of all heart attacks occur outside the hospital. These are people who are walking around who are totally oblivious, or they are ignoring the symptoms. And I found out that women often will just pop an aspirin and say, well, it's just a heart attack. So instead of going to the emergency room,
I gotta go home, take care of the kids.
Yeah, exactly. I was shocked. Yeah, they pop an aspirin and then do not call 911.
They just hope it's going to kick in and work.
I don't know. So, you know,
for women who are supposed to be so smart, that sure is dumb.
Because, you know, we're busy and we're caring for other people.
Well,
but
you can't care for anyone if you're having a heart attack.
If you think you're having a heart attack, you know, and you have the aspirin, aspirin, and then 911 immediately.
So that's still true. If someone's having a heart attack, stick an aspirin in their mouth, let it dissolve in their mouth.
Well, I don't know about dissolving, but I'm telling you, I would call 911 first and then pop the aspirin.
Call that number again.
911.
So, yeah, the older adults, please stay on your meds. And now that we have Medicare D, you know, there's ways. If you can't afford your medicine, then, you know, talk to the pharmacist, talk to your physician, but don't just not take the drugs.
There's got to be some programs out there to help.
Oh, yeah.
And make sure you can get the meds you need.
There are.
Okay. Talk to your pharmacist for sure. Well, thank you, Dr. Janley.
You're welcome.
I don't know what Jamie's going to have you talk about next, but checking around the room, checking all their earlobes, they better make a doctor's appointment quick. Okay, that's just one symptom. You could have had it your whole life. Who knows? All right, well, stay with us. We're going to be right back. We've got plenty to talk about when we get back. We'll be right back.